Vice President Biden, Vice President. That was a joke.
Yes, it was a moment, jokes and all, but they did get serious. Let's bring in ABC News Deputy Political Director Averi Harper, ABC News Senior White House Correspondent Mary Bruce, and also ABC News medical contributor Dr. Alok Patel, physician with Stanford Children's Health. All right, Mary, let's get right to you there at the White House. You know, it was 2010. Wow, that's quite a bit of time ago that Obamacare was actually signed into law by Barack Obama, then president, alongside the man who now serves as president. Just the significance of the two of them being there to discuss this was a big deal, clearly. But before we get to the Affordable Care Act, can we just talk about the talk that this was a bit of a campaign speech? I mean, the way he rallied the crowd and the standing ovation and the energy in the room. I mean, Obama and the Democrats were clearly trying to create some energy there for Biden, who's been having a hard time in the polls.
Exactly, Kira. This White House is trying to tap into Obama's popularity, tap into some of that old Obama magic. And as you said, look, the crowd went wild. There is a very different mood here in the West Wing today. I can tell you that that room is packed, and guarantee you it's a room full of Democrats, very giddy Democrats right now. But the president getting this really remarkable, the former president getting this really remarkable reception just underscores how popular he is. And this president, Joe Biden, look, his poll numbers have been tanking. He's been struggling to get his domestic agenda really up and running. And this is a chance for them to try and hit reset, to try and propel things forward. Of course, the timing is always of note. We are just months away from the midterm elections, and this president needs a boost, and they are hoping that Barack Obama can give that to them. This, of course, was also a chance for Obama and Biden to take quite a victory lap. I have heard Barack Obama speak many times about this. He is always eager to remind folks that this was a really hard fight. Getting the Affordable Care Act done was not easy, but they were committed to this. They've got it done. And since then, 30 million Americans, more than 30 million Americans, have received coverage because of it. And as Obama and Biden are also often frequent to do, reminding everyone that Republicans fought this tooth and nail and continue to fight it tooth and nail. More than 70 times Republicans on the Hill have tried to repeal some form of Obamacare without a plan to replace it. It has gone all the way to the Supreme Court, and we know that this legislation, the impacts of this, have been incredibly popular as well, especially as time has gone on. So this is also a chance for the administration to remind everyone who they have to thank if they are on Obamacare. Now, it's also a chance for them to try and tout the steps that they're taking to build upon Obamacare, right? Announcing these new steps today to strengthen the Affordable Care Act and to up the pressure on Congress, because, of course, there are some steps that this administration has taken, strengthening some of the subsidies that was in part of the stimulus bill that this administration passed not long ago, but those will be expiring. And so trying to up the pressure on Congress to keep this momentum going. Kira.
And Averi, why don't you dig in on that, about what Mary just said? We heard the White House, talk about trying to close that loophole, right, that prevents millions of Americans from qualifying for these subsidies. So get a little deeper into what exactly is that loophole and what's going to be done about it exactly.
Right. Well, we heard President Biden refer to it. It's called the so-called family glitch. Currently, if you're a single person, your health insurance is capped at 10% of your income. That's just not the case for folks who are married or for folks who have children. And so it can make health care and insurance coverage plans unattainable, very expensive for those folks. And so today's proposed announcement is designed to tackle that, right? To allow families to get tax credits if their insurance costs are more than 10% of their income. It's all an effort to sort of address those expanded subsidies that came through the American Rescue Plan in a more sustainable way.
So how long, Mary, will it take for this rule to actually go into effect, what the president actually signed off on today?
You do still need some time here for this to actually go into effect. It does have to. It's a proposed rule that has to then, action needs to be taken on it. So this isn't immediate. And it is interesting. Look, there was no necessary reason for them to do this today, right? It's actually no anniversary. There's no timing here that's causing them to take this action, to give this speech today. But they certainly felt, given the climate politically, that this was a good time to take these steps and to urge Congress to act going down the road.
Got it. And Dr. Patel, as a doctor, how have you seen the Affordable Care Act actually benefit patients in hospitals across the U.S.? How have you witnessed it as a doctor with your patients?
No, Kira, it's incredible to think that this was first signed in 2010. I was in medical school. It feels like ages ago. And over time, I have seen the effects of those 30 million Americans now gaining access to this, especially in the child population. And we think about the fact that there's an estimated 130 to 140 million Americans who have what used to be defined as pre-existing conditions, which oddly includes pregnant women and people with cancer. The fact that they were once charged more for these premiums now seems heinous and now seems archaic because the ACA actually steps in and covers that. And I will tell you two things I see on the regular, still even now because of how complicated healthcare is. We see patients, especially during the pandemic, present very late for care because they're simply afraid of healthcare costs, or they're underinsured, or they fall into the family glitch, or the coverage gap where they don't qualify for Medicaid, or they also don't qualify for a subsidized plan on the healthcare exchange. I also see people trying to play their own hijinks with their employers and what their situation is going to be to try to get that affordable care for everyone. And last but not least, one thing I have consistently seen decrease is evictions, mental illness, and late-stage diagnosis because people don't have insurance. And I hope we continue to push for that progress. And in whatever way we can, we remove the politicization of Obamacare, which is the same thing as the Affordable Care Act. But somehow we saw that with Jimmy Kimmel and all these other comedians in 2017. People out there saying no to Obamacare, but yes to the Affordable Care Act, even though they're the same thing. May we just focus on public health outcomes and the numbers and improving access in an affordable and quality fashion to all Americans.
It's interesting that you were in medical school at the time that this was being talked about. I think we're going to have to get together with you and all. I know you're so young, Dr. Patel, but we should get you and other doctors together that you were in medical school with and talk about this. That'll be segment number 2. But Mary, it's been a year since Biden, has been president. It's been 1 year since he invited Obama into the White House. Now, we talked a little bit about this at the beginning, that we've rarely seen him and Obama together. So how are you kind of reading the fact that they're teaming up today? Do you think we're going to see a little bit more Obama on the trail with Biden?
I certainly think that is a possibility. Look, it is a really rare thing to see the two of them together. This is Obama's first time back in the White House since he left as president. I think it's obvious why he may not have been here a lot during the Trump years, but this is his first time back, even during the Biden years. And even during the campaign, we didn't really see Obama out campaigning with Biden that frequently either. Now, a lot of that was because of the pandemic. They weren't campaigning much, but even there towards the end, when Obama did get out on the campaign trail, those tended to be separate events. And they do have a real friendship, though. As the White House press secretary reminded us yesterday, they have a real friendship, not just a Washington friendship, but they actually have a real personal connection. They had lunch together today at the White House. So aides here assure us that even though we may not see the two of them together publicly very often, they are in communication quite frequently. And I do think you are likely to see, Obama putting some of his political heft, putting his political muscle into helping Democrats, especially as we get closer to the midterm elections.
And Averi, how much do you think that could really help? Is it more the presence of Obama, the popularity of Obama, kind of the vibe that he creates? I mean, clearly they pack the room with the right people, but he does create an energy for sure. But how much would he really be advising Biden versus just trying to pump up the atmosphere?
Right. Well, I think that this event today was really about giving former President Obama the opportunity to make the case for Biden, to say, hey, look, Biden is continuing my legacy. He is building upon the successes of my presidency. Give him a chance, give him more time to continue to do that work. This announcement really comes in tandem with other announcements meant to tackle how Americans are enduring the soaring costs of living. We know that the Biden administration released gallons of oil from reserves in order to bring gas prices down. We know that in their proposed budget, there are some measures that are meant to tackle inflation long term. And then today is about contributing and addressing the high cost of health care for families. So this is all about getting folks on board with Biden and more generally Democrats ahead of midterms.
And Dr. Patel, you know, as of last year, about 31 million Americans had health care coverage through ACA. So what kind of coverage do people need most right now, you think, 2 years into this pandemic?
Oh my gosh, this pandemic, if it did anything to our healthcare system, it was put a spotlight on all the cracks in it and all the disparity that's out there. Now, fortunately, throughout the pandemic, because it was declared a public health emergency, we saw a boost in Medicaid funding. We saw people get free access to testing, to screenings, to be able to go somewhere where they could actually get free care. And a lot of that is in jeopardy right now. And so I do worry about the future after the pandemic and what could potentially happen, which is why, you know, even though the timing right now seems to be playing into kind of whatever it may be out in Congress, hopefully the timing does coincide with the fact that we are nearing the end, hopefully, of the pandemic. We need to start talking about what we're going to do when all those people potentially lose that coverage. We've already heard the echoes of what could happen if we don't get enough of that congressional funding, when in July, people may lose access to free testing and vaccines. So we've seen the benefit to people getting coverage throughout the pandemic when they said, I can go and get tested, I can get treated, and I don't have to worry about the cost. I hope that still continues, because there is a huge benefit to getting people the right preventative health, the right screenings, the right tests, maternal health, all that ahead of time before they prevent late stage to an emergency department with thousands of dollars of healthcare bills. That's what healthcare access and insurance is all about, is preventing the severe illness.
All right, Dr. Patel, Mary, Avery, thank you all so much. Appreciate it.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.